Can heart blockages happen without any symptoms? Yes, you can have heart blockages without any symptoms, but before you panic, let's understand why this happens, who is at risk, and what do the guidelines actually recommend, because blindly testing everyone is not the answer. First, let's talk about why can blockages be silent. There can be a few reasons for it. Number one, the blockage may not be severe enough to cause any symptoms. For example, a mild blockage is less than 50%, a moderate blockage is 50 to 70%, and anything more than 70% is considered severe. So if your blockage is mild to moderate or less than 70%, there is certainly a chance that you may not have symptoms because there is still enough reserve for blood to be supplied to your heart. Especially with low levels of activity, you may not have any symptoms. And our heart has a mechanism where the blood vessel which has a blockage naturally dilates when a person is exercising. So, if that dilation is enough, you may not feel any symptoms. Number two, if you are sedentary, if you are not active, then you may actually be not doing enough activity to cause any symptoms. So if you start exercising or start running or jogging, you may see that you have symptoms, but you were not previously experiencing these symptoms simply because you were sedentary. Number three, there could be a blockage in a small blood vessel. Our heart has a very complex network of blood vessels. So if there is a blockage in a small blood vessel, then it may not be supplying a big part of your heart to actually cause any symptoms. And lastly, there is something called collateral circulation. Coronary artery disease often grows very slowly, and your body quietly builds collateral vessels like little natural bypasses that keep the blood flowing. So, you may not have symptoms despite having a blockage in all these conditions. Let's understand who are these people at a higher risk of silent blockages. People who have diabetes, have nerve desensitization, they have microvascular disease, and they are often found to have atypical symptoms. Compared to men, women also have atypical or subtle signs. If you have chronic stress, then you are also high likely to have atypical symptoms. And people with a sedentary lifestyle, just like we discussed. So friends, if you have blockages, there is a chance that you may not have typical symptoms of chest pain. But here are some other warning signs, which could be unexplained fatigue, breathlessness during routine activities, indigestion like chest discomfort, jaw or shoulder pain, decrease in your exercise capacity, and just feeling very off during exertion. So if these occur, these also count as symptoms, and then we may need to investigate them further. Now let's answer the question, should you get tested even if you feel perfectly fine? So here's the important part. Guidelines do not recommend routine testing in people with zero symptoms. Why? Because it does not improve outcomes and it often leads to unnecessary procedure after procedure, and some of these procedures are high risk as well. Instead, if you do not have symptoms, we recommend knowing your numbers, your blood pressure, your LDL cholesterol, your hemoglobin A1C, your body mass index and waist circumference, your smoking status, your family history, your stress levels, your sleep, and your lifestyle. Your cardiologist will use these to calculate your risk score. And if your score is high, in that case, for risk stratification, they may recommend a calcium score of your coronary arteries, which helps to refine your risk and can also be helpful to decide if you should be on a statin medication for prevention of coronary artery disease or no. On the other hand, if you have symptoms or you are high risk with abnormal EKG or imaging finding, then you may need to get more testing like stress or angiography. So friends, the take-home message is you can have a heart blockage without symptoms. The solution is not panic or unnecessary testing, but you should know your risk. You should know what you can control. You should recognize your subtle symptoms early, and you should work with your cardiologist on a personalized plan for you. I am Dr. Toishi Sharma, Interventional Cardiologist. Do not forget to subscribe and share this video if you found it helpful, and I'll see you in the next video. Thank you.